Hello, welcome and kumusta? This is How, your host, and this is OT Conversations. We are talking about matters involving occupational therapy, little things that will help you be a better clinician, and perhaps you'd like to update on some of the foundation knowledge that you may have forgotten over the years. So this is for a lot of people. This is for occupational therapists, clinicians, young, old clinicians, students. Yeah, everybody's welcome. In this episode, we are going to talk about the Rancho Los Amigos for cognitive functioning. I am sure all of you are aware at the moment that there is a huge talk about delirium, and there is a big movement around it. There's a lot of talk about it. So one issue that I feel is that when you're talking about delirium, people are talking about hyperdelirium, hypodelirium. Yeah, that's okay, hyper and hypo. But if you want to use that as a measure of success and you do something, what are you going to do? How are you going to measure this? Does it mean that you have made them hypo or normodelirium? Like for tone, you have hypertonic, hypotonic, then you have normotonic. Delirium, hypodelirium, hyperdelirium, normodelirium. Okay, so no, I think what is nice, and I know that something that you can use is this scale called Rancho Los Amigos. And this is very simple. Now, when I was studying, we have equally paid attention to Rancho Los Amigos and Glasgow Coma Scale. But for some reason, in the United Kingdom, Glasgow Coma Scale is the scale being used, and it's much more utilized, perhaps because it was developed in Glasgow. Okay, but Rancho Los Amigos is a scale for head injury or cognitive behaviors after head injury. And Rancho Los Amigos is in California. So this is American, actually, but it's as old as the Glasgow Coma Scale, if I'm not mistaken. They're in the same era and generation. So with Rancho Los Amigos, there are 8 stages. Okay, so from 1 being not so purposeful and not so good at all, yeah, all the way to 8 where they are almost near normal. And if you listen to the stages, the way on how I would describe them, if you look at this scale, you can see your patients falling or progressing from stage 1 all the way to 8. And then at any point where you see a person, you can actually pinpoint them onto the level that they needed. Okay, so let's talk about the scale. Level 1 is no response. So the person is unresponsive to stimuli. So that's level 1. Straightforward, isn't it? So levels 1, 2, and 3, they're actually talking about responses. Yeah. Okay. So response 0, nothing. You talk to them, nothing. You move them, nothing. You make a noise, nothing. Yeah. It's understandable to have no response if they are sedated or they are paralyzed, particularly if they're in critical care. But if they are off sedation, you talk to them, no response, their eyes open, nothing. Zilch. Okay. 0, no response. Level 2, they would be showing response, but it's more generalized. Yeah. Okay. So here the responses are non-specific, they are inconsistent, and it is non-purposeful reaction to any stimuli that or any stimulus that you provide. So generalized response. Okay. Level 3, when they're responding this time around, they have localized response. And the person here is, the responses are directly related to the type of stimulus that you provide, but they are still inconsistent and they are still very much delayed. Give the input on the system, on the visual or the auditory or the tactile, and it takes a while before they process it, and they will respond. But it's non-specific. It's just generalized. So hit and miss. It's never consistent. Now, levels 4 to 6, so it's 4, 5, and 6, it all talks about confused state. Okay? They're in a state, they're awake, but they are confused. So level 4 is confused, but they are agitated. Confused, agitated. Yeah. Here, the response is heightened, so they are severely confused, and they could be aggressive, the combative type. They're very hyper responsive, hyper reactive, confused, and agitated. Then, if you imagine this person getting confused and agitated, then they settle down, but they are inappropriate. So they're still confused, but they're more settled down. Confused, inappropriate. So some responses they have some responses to simple commands, and it may be purposeful. They have more confusion with a more high level complex commands. So in here, a person can just show their teeth, shake their hand, close their eyes, if you give them instructions. So one stage command. And around this stage, person is still highly distractible at the moment. So they're just tired. They're just not agitated anymore. So they're still confused, but inappropriate. After having a period of inappropriate and being confused, things start to make sense for them. They are now at the stage of confused, appropriate stage, and where the responses are more goal directed, but cues are still necessary. Okay. So there we go. So just a quick recap. From 1 to 3, it's all about responses. And then from 4 to 6, it's all about confusion. But all the things that's breaking them apart would be the level of their agitation. Now, 7 and 8 is now about appropriateness of response. And so there are two types. Number 7, they are appropriate, but they're automatic but appropriate. Only automatic. Just think of them like robots. So their responses are like robot-like, but there is a problem with high level of thinking. So they have difficulty with judgment and problem solving, and that's lacking. But it's automatic but appropriate. Now, level 8 would be purposeful and appropriate, meaning their responses are adequate, but there are still some subtle impairments. So there you go. So it's from 1 to 8, Rancho Los Amigos, very useful scale. I hope you can use this in your practice, guys. So take advantage of this. What we're doing now is that I am asking my team to actually use this in how we are communicating. Oh, actually, no, I don't want to take the credit for that. It is a joint agreement between the team, the ones that I'm working with, that we will start to communicate using this when we are describing the level of confusion. So cognitive levels just based on behavior of the person. We're not even thinking about the contents yet. We're just thinking about behaviors and consciousness. Okay? I hope you learned a little something today, guys. Just to let you know, if you learned something, pass this on to your friends. If you find it useful, share it with your friends. Talk about it. Have discussions around it. Grow together. Develop those skills together. Just remember, everything you do matters and has an outcome. Until next time, bye.